People must decide their fate!
Abortion inches toward the Florida ballot.
We've been blown away. We never expected to get almost 250,000 volunteer petitions.
Will it get there? Will you get to decide? They're already moving bills. Are you watching?
They want to work. This bill gets government out of their way.
Should teens get more work, less protection?
At the same time, touting that we are protecting children in this state. It's contradictory.
Should public schools relax the rules?
We can't promote students that are not ready to be promoted.
When I hear this talking point that we are lowering the standards of education in the state of Florida, that is the furthest thing from a truth.
South Florida homes. Shaking and breaking.
This is my living room. Seismic damage is specific.
We have no say into something that's damaging our homes here.
Who reins in the rock miners?
While I fight for this issue every single day, most of the other members don't see it the way that we do.
And verdict in the case that shocked the state, a heartbreaking loss for a prominent South Florida family.
The grieving really has been difficult. One of the things that's happened as a result of the circus and the attention.
The big news of the week, exclusive interviews, all live this week in South Florida.
For years, Jack Melnikoff enjoyed trouble-free vision. Then he started having persistent redness and dryness that even moisturizing eye drops couldn't ease.
So it would start to burn first thing in the morning and it would go throughout the entire day, and it was very painful.
Jack was ultimately diagnosed with dry eye disease.
It's the most common disease that we see in our eye care practice.
Symptoms of dry eye disease include a scratchy feeling like there's something in your eye, stinging or burning, redness, sensitivity to light, and blurry vision. While there are several causes, optometrist Dr. John Bascom says 86% of cases are the result of something called meibomian gland dysfunction.
It's a gland that every time we blink, it releases oil onto the eyelid surface and it protects the eye from drying out and evaporating. However, when we're not blinking, it's not doing its job, and so the eye is drying out. It's also causing the oil in the eyelid or the gland to start to harden and turn from an olive oil type substance into more of a wax.
To get the gland working correctly again, the doctor treats patients with an intense pulsed light or IPI device. It's the same technology dermatologists have been using for years to soften our wrinkles.
What they found is that those patients that were being treated also had an improvement in their dry eye related symptoms. So that's how it kind of progressed, and we're now on 6th generation intense pulse light devices that are much safer, have a very low incidence of side effects, and are really effective at treating dry eye disease.
Jack says the treatments were quick and painless and brought noticeable improvement.
After 4 treatments, after the first one, I started to feel some relief, and after 4 of them, my eyes feel light again. I don't really have to worry about the dryness and the redness anymore, and it's been great.
So after the initial 4 sessions, patients still need to undergo 1 treatment every year to maintain the benefit. If severe dry eye is not treated, it can actually lead to damage to your cornea. That's the clear outer layer at the front of your eye. With today's HealthCast, I'm Christy Kruger.
According to the National Survey on Drug Abuse and Health, an estimated 2.5 million Americans suffer from opioid use disorder. But Dr. Andrew Migliaccio, a psychiatrist and the medical director for Memorial Outpatient Behavioral Health, believes the survey findings greatly underestimate the true figure.
It's probably 2 or 3 times greater than 2.5 million. It might be 6 or 7 million. So obviously there's a huge public health interest in making sure that these people are connected to the care that they need.
While the study did not explain why 80% of people who need help aren't getting it, he says long-held beliefs may come into play.
There's kind of this historical concept that you're not sober if you're taking medications, but we have, I think, taken great strides to kind of redefine what recovery looks like. And oftentimes recovery is assisted by medication support, which allows people to become stable and live more normal lives.
Those medications include buprenorphine, Suboxone, naltrexone, Vivitrol, and some cases methadone, which are all considered safe and effective.
One of the findings in the study was that people who received these life-saving medications we're actually more likely to have received treatment via telehealth. So telehealth seems to be one potential solution for providing this necessary care.
With the right treatment, studies have shown not only a reduction in relapse, but that patients are getting back to a full and productive life.
That's what we try to move people towards, is really living a life worth while for them.